Welcome, Stefanie Long, to the Dish with Dina podcast. Thanks so much for joining me today.
Thank you so much for having me. I'm so excited to be here.
I'm excited too because, our friend Chrysler Bailey put us in touch with each other. I was just telling you that she did the podcast interview back in December of 2022. So I can't believe how long that's been. And I'm so pleased that we keep connecting with other people because you and I have never met before. So it's a pleasure to have you on.
Yes.
Will you share with our audience a little bit about who you are, where you're at, and what you do?
Yeah, Stefanie Long. I am a doctor of physical therapy, specializing in pelvic health, specifically female and pediatric pelvic health. We are in North Fort Worth, around the Dallas area. Um, and I own a practice here in town called Concept Pelvic Health.
Will you take us back a little bit about where it all began? When I interview healthcare providers, sometimes they are second careers, or sometimes they knew from the very beginning what they wanted to do, or something they also had a personal journey that led them in that direction. So where did it all start for you?
Yeah, so I like to tell people because I get this question asked a lot, like, why do you do this? And the answer is that I was kind of drug kicking and screaming into pelvic health. I was exposed to it very early on, which, 17 years ago, most physical therapists didn't know that pelvic health existed, even though it had been part of our field for a while. I had a lecture in it, again, potentially ahead of its time, that we even had a lecture. I did a clinical just to kind of see what it was. But at that time, I thought it was just going to be pregnancy postpartum, like just going to be pregnant patients, and that was going to be fun and babies and woo. But then I got there, and all she had was pelvic pain patients, mostly chronic, long term pelvic pain patients. And so I was kind of like a deer in headlights going, I'm sorry, you do what, where? And I'm like, I wasn't meant to be a gynecologist. That's not what I want to do. At the end of that, I was like, you know what? I'm so glad that you do this, but it's not for me. Fast forward, my first job I got actually through my school, and my boss was a pelvic floor therapist who had studied under the same girl that I had done clinical with. And so she was super excited that I was coming on board and had exposure. Uh, and I'm like, no, absolutely not. I do not want to do this. And she's like, but like maybe you could like help me in certain ways. And I'm like, I don't know. I don't know. She's like, oh, you don't have to do any of the assessments. Like, maybe just work with the pregnant postpartum patients. Okay, fine. That's what I'll do. And she's like, well, I'd like to grow this department. Could you maybe like just talk to patients about it? And so we've started screening women with low back pain. Because, side note, it's like around 90% of women with low back pain also have pelvic floor dysfunction. And so we started screening those women, just asking them questions about like whether they leak when they laugh, cough, or sneeze, whether they feel like they're going to the bathroom all the time, whether they're having any type of pelvic pain, things like that. And we grew an entire department. Filled her schedule up with pelvic floor patients because it's all around us as PTs. We just didn't necessarily recognize it. So we grew the whole department, and she's like, maybe I do need some help still. Like maybe you could do it. And I'm like, no, Tammy. I said no. Then I got pregnant, and I had a little boy. I delivered. Everything went fairly smoothly. That was fine. But afterwards, I had terrible tailbone pain, and I had really bad incontinence issues. And I had to go to a pelvic floor therapist. And so I went and I did the treatment, and I was like, oh, this isn't so bad. Like this, and it helped so much that I was like, okay, this is what I've got to do. I actually ended up staying with this therapist throughout my next pregnancy, and that delivery was like night and day different. I wouldn't say that it was painful, but I was at like 9 centimeters. Didn't know that at the time, but doctor came in just to check and see how far along we were. I was being induced for a reason, so I had a Pitocin birth, which some people know that is much harder labor. And I'm just like sitting on the ball, like bouncing on the ball, waiting, waiting out labor. So she comes in, she checks, and she's like, "Okay, are you ready for an epidural?" And I said, "Oh, I'm just waiting until it gets bad." She's like, "Oh no, like you're 9 centimeters. Like this is like last call." I'm like, "Oh, well, this is different. I mean, completely different than my first baby, where I was screaming for an epidural at like 2 centimeters." Um, and so it was truly after that that I decided like this can help in so many different ways. And I could be so influential in women's lives that this is where I have to this is what I have to do.
As is
So,
always the case with these episodes, I am scribbling down. So for anybody watching this, you'll see my head bounce down and bounce up again. And I've written so many notes already where the not for me, right? Starting off with what we have in mind of what we think our journey is going to be, and then plans differ, whether it's something like in your case, you personally had the need for implementing that approach and that management. But other times people will tell you things too, like you're really good at this, or you should keep an eye out for that thing, or did you ever think of doing XYZ? And because I teach students as well, and maybe you also work with interns too, we'll get to that discussion too, Stephanie, in a sec, about being open for opportunities that come your way, even if you feel like that's not necessarily the thing that you started out doing, because you just never know where things are going to lead you. And then taking that into account when you said once you did start implementing and being actively involved in things, it was like the floodgates opened, like you established an entire department full of patients that not only were you able to serve, but actually were waiting for you to serve them, almost like they were
yeah.
so happy to have found you. So, will you talk a little bit about that too? About if you were to, and this could be really anybody. It could be students who are looking to move in a direction and not sure what their career is. It could be people who are looking to start a new journey of chapter of life. Will you talk a little bit about how that works with you? Like, what are the things that you're open to, or what are the things that you feel kind of lined up in order for you to be able to do what you are doing?
Oh gosh, the things that lined up, it was just like one thing after another. It was just a matter of me like actually recognizing that this was something that was so helpful. Um, I I don't know. I just feel like I feel like the signs are always there. It's just a matter that we have to be like really open to them. But I also feel like I would encourage people to try that new thing, right? If an opportunity presents itself, like why not? I've always told this to my children, and I hope I keep telling them that. But like, let somebody else tell you no. Don't like say no for them.
Right. I think, there's definitely a thing about aligning your mission, your message, your values, and saying yes to certain things and seeing where things can lead you. And I really like that too. Like, what's the point? Like, just throw your hat in the ring. If it didn't work out, at least you can always say, at least I tried, and I don't really regret it because I learned something from it. So I love that stance. Will you tell us a little bit about I never say a typical, I would say maybe a current week in the life of you. Tell us a little bit about your daily activities of the patient population you're working with, and then we'll talk a little bit too about the business side of things.
Yeah, so my week to week is probably a little bit different than your traditional like pelvic floor physical therapist because I own this clinic and we have, counting myself, we have 4 therapists all dedicated to pelvic health. That's all we see here in our clinic. And so I don't see patients full time anymore. And so, there's some business stuff that has to happen in order for other people to get paid and for the clinic to stay busy. But in a typical like physical therapy clinic, how we do it here and how I feel like is the best way to do it is we have hour-long sessions. So it's typically for our therapists, probably 8 patients a day that they see. And then, I mean, that can vary based on how many hours you're seeing them for. But we typically see patients for a whole hour by themselves. Um, I often thought, like back in the beginning, that that would be too much time. Like I would be bored. There's so many things that you get to address whenever you have a full hour with somebody. And so while it sounds like a caseload is actually pretty light, only having 8 patients a day, it's also very heavy in the types of patients that you get. We see a lot of pelvic pain. And that means we see a lot of women that have had some sort of like trauma, whether it be emotional trauma, whether it be physical trauma. whether it be just the fact that somebody down the line has basically told them that they're broken, or they've been passed back and forth to different providers because no one knows what's going on. They don't feel like they've been listened to. I mean, all of these things, they come and we see a lot of tears in our clinic. Um, Unfortunately, we just had one come in that had a doctor tell them that they were gross. And that was horrible. Um, and so she came in and was just in like absolute tears about it, and like rightfully so. And so our caseloads are smaller, but they're also heavier. And so you have to have good work-life balance. You have to have a good outlet. Uh, we would recommend mental health therapy for everybody, but ourselves included, just so that we're not carrying other people's burdens too. Goodness, we see all kinds of patients here beyond pelvic pain, incontinence issues, urgency issues. At our pediatric program, we do bedwetting and delayed potty training issues, logical surgeries. I mean, the list goes on and on for what we can see in our clinic.
Right, like there's a common thread that runs through everything, but just with I think a lot of healthcare practitioners, while on paper maybe there are similarities, every person is coming individually with some other experience or factors that are going
Mm-hmm.
to make things very customized or individualized for them. So before we venture into some of the other questions I have for you, on the physiological anatomy end of things, can you just describe what it is that you do and what the pelvic floor is and what it does and why we need to know about that?
Yeah, so the pelvic floor is very integrated into just about every system in the body. The pelvic floor is the first muscle to fire before every other muscle. So when you go to kick a ball, your pelvic floor had to fire first. Throw a ball, pelvic floor fire first, because pelvic floor is the driver of core stability. So yes, it has a sphinctering part of it. Very little of it is actually the sphincter part, though. So it does sphincter the urethra and the rectum. But the majority of what the pelvic floor does is create stability for our bodies and for our core so that everything else can move well. When your core isn't working well, you see all kinds of dysfunction. Go into any gym in America and see those wonky things that people are doing, and that is likely because their core is not working the way it should. That's why you should be concerned about your pelvic floor, especially if you have low back pain and hip pain, because all of those things are definitely playing into each other.
When people do think of core stability, they immediately go to abs and they forget maybe everything else. And I really think it's important that we integrate different parts of the body or we bring attention to different parts of the body because especially I don't know if I can really generalize this, but people are moving around so much. They kind of mindlessly get up out of their chair, get into their car, and they don't necessarily realize when they're twisting and turning. And I half joke, but this is true for me at least, I sneeze and I pull a muscle in my back. Like that's my life these days. But I'm sure at some point it was because something either got weakened or I wasn't really paying attention to something, or it's also a chance for me to get back in tune with my body and making sure that I'm aligned and I'm in balance and I'm preventing anything worse from happening. So this was very informative to understand a little bit more about like what we should be paying attention to when we're doing things. It's not just about lifting, from your abs and doing crunches. It's about really starting where it all starts. So tell me a little bit too about the discussion around, we use this language also about trauma and how our body can hold on to things. And I really love this, what sounds like a holistic approach in your way as well. You're doing manual manipulation of things. Are you teaching people how to help themselves at home? Are you doing virtual sessions? Like, what is it that you need to kind of see in order to recognize, or are there any x-rays or things that people have to do before in order to get assessed? Or is it just about having them share their thoughts, their concerns, and like pointing at where things may be hurting for you to be able to then do what you need to do on your end?
Great question.
Yes.
We do see patients here in the clinic. We do some telehealth, although I would say that telehealth is very limited because you're not actually touching somebody. You can see very little with telehealth just because you're limited to the screen. So we do some telehealth, but usually that's for people who can't make it into the clinic, and it's like our only option. Or it's something like postpartum where we're just like checking in with them just to make sure that everything's going well. As far as like what they need to do, I feel like the assessment looks at a lot of different things. So it looks at how you're moving. It looks at your posture. It looks at like how strong you are. Maybe in like a traditional like hold and let me push you kind of way, or but more likely in a functional way, like how well do you squat? How well do you how well do you do a single leg squat? How's your balance? Because that can look at like how stable your hips and how your ankles are, because all of that from the ground up is going to affect your pelvic floor. But a big part of what we do with the majority of our patients, as long as they're okay with it, is a pelvic exam. And so when you think pelvic exam, you think gynecologist, right? But they are looking more at the organ system, and we are looking more at the muscle system. So it's digital. There's no speculums involved. It's just a one finger in the glove finger in the vaginal canal, and we are going through each muscle individually, looking for tension, pain, nerve issues, just like you would anywhere else. So if you like rub on your upper trap, you could find a place that like has a knot, quote unquote, right? And that's in a nutshell what we're kind of looking for there. We might also look at coordination in your pelvic floor, like how well is it firing, like when you cough or sneeze, how well is it firing when you're doing certain activities. We might do a standing assessment in that same way for like if your problem, very few people have problems when they're laying on their back, right? It's usually when we're standing up. And so standing assessment is a good way for us to see if something is going on in that way too. So that's probably the extent of the that evaluation, but all of it is so important. And we continue to evaluate as we go. Most of our treatment sessions are very hands-on in our clinic. So we see women come in and we do a lot of manual therapy. So that's like your soft tissue mobilization, joint mobilizations, working with like neuro-rehab, which would be like how to move better, and then making sure that we give them something functional as an exercise to send home with them. As far as like self-treatments, yes, we do explain self-treatments to people. We can use different tools for that. Perhaps it's not a tool. We have wands that help with mobilizing the pelvic floor. There's dilators for certain people. There's let's see, what other tools could we use? There's a variety of things that we could use there, but everybody goes home with something. And my goal at the end of your therapy, when you are discharged, is for you to feel very confident that we have decreased dysfunction far enough that when we are in our day-to-day lives, that we're not seeing we're not seeing any pain or issues, but also that if things creep back in, that you have the tools to stop it and bring everything back down. And then we're here if it gets away from you. But the hope is that you never have to darken my doors again.
I say the same thing too. I would love, for people to hang out with me, but the goal is to be able to provide people with strategies and tools and have them become a little bit more aware of what their individual needs are so that
Mhm.
we can exhaust our sessions and then they can go home and they can take care of themselves and maybe just come in for maintenance every once in a while. Which actually brings me
Yeah.
to my next question. Do you take insurance or are you doing self-pay mostly in your practice?
Well, what you will find is most pelvic floor therapists are going to be cash and or out of network with your insurance companies. And that's for a variety of reasons, mostly because insurance reimbursement is horrid, and it goes down every single year. But it's also based on codes that we use across the board. So every physical therapist is billing the same codes. And so in outpatient physical therapy, you're seeing 2 to 3 patients an hour. And so those codes, the payment of those codes are based on the fact that most therapists see 2 to 3 patients for that hour. And so you can't keep the lights on if that reimbursement is so low because we only see 1 patient an hour. And so if you do find somebody who's in insurance, I'm sure there's people out there doing it well, but the majority around us are seeing multiple patients at a time, and just one is in a room and one is out in the gym, or they've shortened their sessions down to just 30 minutes. And that's like where they see it, so they can see 2 patients an hour. Now, that's not to say that that's bad. I don't think it's the best way, but it's also something that not everybody can do cash. And it is very nice to have people that we can refer to that do take insurance, because something is better than nothing. And those therapists are still doing all good work. It's just, in my opinion, we have the best way of doing things as long as that's possible for the patient.
We've had many discussions on this program about insurance-based or self-pay. And this is also, why I like having discussions with other healthcare providers for both benefiting the people who are providers themselves and also the patients themselves, knowing that sometimes it's not our fault. Like we would love to work with you. We would love to be in network with things, but as you said, we also have to pay the bills. And especially when we are considering ourselves entrepreneurs or we're running a practice of our own, we have taxes as well to pay. So like we're responsible for all the accounting and all those things. And yeah, insurance isn't great. But I know on my end too, and also having been somebody who went to a physical therapist for other injuries that I've had in the past, there are limitations. So even if you are
Mm-hmm.
able to go and utilize, or if you're able to be in network, sometimes we're quite limited. So I've given the example many times if I work with a particular insurance company and that patient has unlimited sessions all through the year, $0 out of pocket, no payments, no referrals. That's fantastic. We take advantage of that. Other times I have somebody that limits me to not even hours, but visits, like 3 visits, and that's it. And if I meet them in January or February, like I'm supposed to meet them once a quarter and then kind of leave them on their own to do all these other things, or we exhaust the sessions that are covered by insurance, and then they have to have the option of, okay, do you want to start paying out of pocket? So it really is quite the dilemma to be able to give quality care and quantity care too, to be able to see people as long as they need to be seen. Because I was going to ask you next is what is the typical or average amount of sessions that people would need as far as a regimen is concerned to get them from point A to at least back to where they feel they can move around better or have strengthened what they need to strengthen or manage whatever condition that they're dealing with, or does it depend?
I'm sure it depends. Every patient is going to be a little bit different, right? But on average, we do have averages that we see here. And then this is also what I would point out to people who are like feeling like they have to do insurance, like I pay for it, I need to utilize it. I get that. I absolutely get that. But a lot of times, if you have a higher deductible, we end up being a lot cheaper because insurance like rates when you bill insurance the it is all skyrocketed and because they're only paying a percentage of that but you have to pay the whole percentage of it so we typically we're a little bit cheaper if you have a high deductible but we see patients once a week usually for the first like 3 to 4 sessions and that's just to kind of get that buildable progress. Beyond that, people start to feel better, significant improvement around that like 5 visit mark. And then we start to like spread our visits out because at that point we need to build resiliency in the system, make sure that you're getting back to all the things that you want to get back to. And so we're spreading our visits out like 2 weeks, and then we try and go 3 weeks, and then we try and go a month. All in all, we typically see patients between 10 and 12 visits in a 6 month period.
Okay, that actually is a really good point. Out of network options, like checking with your insurance company and saying, I'm definitely picking somebody who's not in network and I'm not going to be using that. But if I submit the super bill, the invoice to my insurance company, can they reimburse me or can they, is there some way that I can meet something? And then, as you said, sometimes it might work out, especially if you're going to somebody quite often. So thank you. Thank you for that too, to remind us about that. Also, I want to talk a little bit about the business end of things. What is it that feels most organic for you, but also maybe what drives traffic to your business? Is it mostly word of mouth? Are you promoting yourself? Are you doing networking, collaboration? Does social media play a role? These are things that, we live in a day and age where I feel like people will feel compelled to take a particular road and not necessarily know that they could do something different. So I always like to kind of see what works best for you in getting people to your door.
I mean, so we obviously have social media. I try and be good with it. We end up having, periods of time where I have not posted in a while. And it's just because that's never been a big driver of patients through the door. I think that people go to your social medias just to make sure that you're legitimate and that you're still active and you're still there. But we've never had people come in and it's like, oh yeah, I came across your Instagram post and now I'm walking in your door. The vast majority of where we get our people is, I guess, word of mouth, but also just being in the community. It's one thing that I've always tried to do is just be integrated into our town and then the towns like just real close around us, because that's where you're going to find people. I go to a lot of like chamber events, and I'm always surprised. I'll go and meet with anybody. So if anybody like calls and they're like, "Hey, I own a CBD store down the road," I'll go and meet with them because a CBD store in Fort Worth was a good referral for us for a while. So I found that building community is like super important because you never know when that next referral is going to come in. Maybe it's a realtor that has a wife that is hurting. Maybe it's a doctor down the road that you meet. There's so many ways that patients can get to us. And so I just try and be really involved in the community. I also try and be a involvement in the people of the community too. So we host community events. We try and do it at least once a quarter. And that's typically not just a like, hey, come learn about pelvic floor. But I try and find things that I would be interested in coming to. Because all too often, them just being in our building, start asking questions like, "Oh, what do you do?" Like we had a sourdough workshop here. We do a trunk or treat every year. We're about to do a mom's day out thing. So yeah, I feel like that's where majority of my patients have come from.
That is super fun and very creative. Like you said, kind of thinking outside the box of not necessarily just being delivering the message of what you're doing, but also on a more collaborative level, the things that are integrated with that, and just kind of like making it fun, a place for people to go. I think after the restrictions of COVID were lifted, we started losing what is called the third space of places that we can go to. So a lot of us stayed working home, a lot of us were going back on site to work, but then there weren't other places or other options for us to get back to, like cafes or libraries or things. So it's nice to kind of just, breathe new life into that. And that's such a
Yeah.
wonderful thing for people to see. And then they collaborate, they chat, they get to know you, whether or not. I think this is important too. One of the things that I keep saying too, and yes, again, I realize we need to pay bills, but I think whether or not people utilize our services immediately after we do something like that, or after we put, social media up or we promote ourselves, I think just being known to be of service to people is what makes me feel good as well. And they'll find me when they're ready, like when they're ready to return, but they know that I'm there to provide them with some low cost options or free things like events or webinars. And then if they decide to use my services down the line, but in the meantime, you're still in the back of their minds. I think that's such a wonderful way to engage in your community, Stephanie. Okay, I want to talk now about you had mentioned before work-life balance. So what is it that you do to handle all the things and also handle yourself? And also, I'm sure family responsibilities play a role in this too. What are some of the non-negotiables for you these days?
Oh, non-negotiables for me. Oh, that's a great question. Do I do what I preach to my staff? Uh, having a business really means that you're kind of in it almost 24/7. Like even in the evenings when you're on a walk, like with my husband, that's usually how we connect. We need to walk the dog too, but it's a good time for us to be alone. I have three kids. I didn't say that at all, but I have three kids, high school and middle school, and so they are doing all the things because they can't drive yet, and so we're constantly on the move. And so in the evenings, Patrick and I will go on a walk, but all too often we end up talking about the business. And so it's really, I think it's really important for you to, when you do step away, for you to like put everything else aside, all of the stuff. And so we have done where we've done like a weekend away. We like to hang out with like friends on the weekend to make sure that we are getting our cups fed as well. We do game nights and things like that. I play golf with my dad sometimes. I just think that you just got to make sure that you're doing things that you enjoy as well.
Even if it's snippets within the day. Like today is a very busy day for me, but at the very least, I'll have an hour to myself where I can maybe go out for a walk or just,
Yeah.
I don't know, journal or just sit in silence if I want to. And I think that's important. So everybody's going to be doing something, whether you're running a business or you're working or you're managing a family or a little bit of everything. Finding those quiet times and finding that time to socialize and really, again, like you said, kind of give back to yourself. Can't pour from an empty cup, as we say.
Yep.
So making sure you have that time for yourself. Stephanie, I want to go back for a sec to talk about more of the patient end of things. There's always going to be a disclaimer in these episodes about we're not giving medical advice, but if you can say maybe the top few things that you come across a lot that people could either take into account in helping them, whether it's prevent something from happening or reduce the risk of something getting worse, what would be some of your top considerations?
I think always in when you're talking about pain in general, and wear and tear on the body, that maintaining mobility is huge. You don't have to be a CrossFit athlete or a bodybuilder strong, but you do need functional strength and you need to be able to move your body through its range of motion. So those would be the two top things that you need to maintain through life. When you stop moving, which includes just like literally walking, can be very functional, right? Then that's when you start to like age. And the more active you are, the better. The more you get up and down off the floor, the better. One of the best exercises you could potentially do is just literally getting down on the floor and getting back up 10 to 15 times. It's almost a full body workout. And it will keep you mobile even when you are in your 90s and you fall or something like that. If you've been practicing getting up off the floor, then you will have that available to you as opposed to if you're just sitting around doing nothing. Now, when you're speaking specifically to pelvic floor, I would say that this seems very cliche, but managing stress. The stress response for women is for our pelvic floor and our upper traps and our neck to fire. It's the first thing. Even the research study actually showed with even just watching somebody having some sort of trauma caused muscles to contract. And so I think that managing stress is a big one. Going back to the whole like have a counselor if you've been through any type of trauma, make sure you're working through that. Breathing, making sure you breathe well. Uh, that is just good for your entire system. Illness and sickness is correlated with a faster breath. And so taking the time to doing some of that box breathing where you breathe in, hold for 5, breathe out for 5, hold for 5, breathe in for 5, and going around that box at the end of the day, throughout the day, whatever, that would also be very good for just your pelvic floor in general.
Those are fantastic takeaways. And I'm really hoping that people who need to hear this have heard it and can implement that too. And I also like what you said too about the therapy or having a counselor. As part of what we do as dietitians, we do what's known as medical nutrition therapy. We talk about the education of people's disease states, we educate them on the food, and then we also do some supportive counseling for helping them with, breaking down barriers of establishing habits, et cetera. But we are not therapists and it's outside of our scope of practice. And nor do I feel comfortable if somebody is dealing with disordered eating patterns or family trauma or anything like that, where I appreciate people feel comfortable in talking to me, but there's only so much that I can do. So I really want to make sure people know if the better they can build up or the more ability they have to establish an interdisciplinary team for them where everybody is specializing in something that can speak to their strength and they can have the best use of those providers around them versus, somebody who might be speaking out of their scope or doing more harm than good. Like if you don't understand the language that you're using as a provider, and that could potentially trigger somebody, and then they don't either come back to you or something worse happens when they do leave your session. Just being conscientious of that. So thank you for bringing that to the
Mm-hmm.
attention as well. Yeah, stress is a huge one. It's so funny, even in the dietetics field, everybody thinks like food and nutrition, yes, but one of my first two questions are how's your sleep and how's your stress? So I guess we will end on
Okay.
my final question, my two-part question, which is what is on your plate today, both figuratively and literally, Stefanie? As soon as we disconnect from each other, what is the next thing you're going to be working on, maybe in a professional or personal matter? And then what is the next meal that you'll be having?
Professionally, we are working here to continue our outreach and potentially looking at having a second location. So that's kind of where we are working. Literally today, I've got a full afternoon of patient care, and I can't tell you what's for dinner tonight, because my little sister is in town and she gets to pick. So, but she's living in Chicago, so it'll probably be barbecue, Mexican, and Whataburger.
I love surprise meals. I love when people are in town. I love trying new places. It's all dietitian approved. Oh my gosh, that's so fun. Have fun with her. That's a wonderful thing.
Yeah,
Do you get to see
yeah.
each other often or no?
Probably like 2 times a year.
Okay. So that's
Yeah.
good. It's good to have her in here. Well, Stefanie, thank you so much for spending time with us. And I'm really sure that people are taking away quite a lot of things, especially if they are, working in the vicinity of that pelvic health. And if they're dealing with any trauma or pain, they know that they have you as a resource. So I very much appreciate this discussion and I wish you a wonderful rest of the day.
Thank you so much.